Before we talk about radiation and sexual side effects, I just wanted to let you know that we're having a live in-person conference and it's free. We're going to be covering advanced prostate cancer proton therapy and prostate cancer imaging on March 11th here in Los Angeles. If you're interested and you would like to come, you can click the link in the description below. Now back to Dr. Scholz. So, Dr. Scholz, last week we talked about mitigating sexual side effects from surgery, and today I thought we'd talk about it from radiation. We had many requests for this. So first of all, can you explain the radiation that goes to the whole prostate and what the sexual side effects look like as far as the timeline goes? Does it happen, right away, 6 months, 2 years? What does that look like to us?
Right. It contrasts sharply with surgery, in which men get immediate impotence right afterwards and then slowly recover if they're going to recover. With radiation, the onset of impotence, if it occurs, is delayed up to 2 years after the radiation is administered. Studies seem to indicate that if you get 2 years out from radiation and the shoe hasn't dropped and you're still functioning, that your risks after that are the same as anyone in that age group. As men get older, they develop erectile dysfunction, so that's just part of the aging process. But it's not accelerated after 2 years. So it's within the first 2 years, there can be a drop-off of sexual activity. Talking about erectile dysfunction with radiation or surgery, it's interesting that in the prostate cancer world, we only define erectile dysfunction as when Viagra and Cialis medications stop working. The rest of the world describes it as impotence if you need Cialis or Viagra. But in the prostate cancer world, since there is a drop-off in sexual function, we're not calling erectile dysfunction if someone can take a Cialis pill or a Viagra pill and get restored back to functionality. So that's functional sexual capacity. So we have to be careful about definitions also when we talk about this subject.
I'm glad you mentioned that because it's oftentimes I'm talking to patients, even at the conferences years ago, we'd have these intimacy conferences and they would say, well, my sex life just isn't what it was. I had no idea I was going to have to take pills. And something I've learned from you that you brought up recently, so can you talk about the dosage of Cialis? It sounds like, some men get confused. There's like 5 milligrams, there's 20 milligrams, there's a timing of it. What is the proper dosage and the proper timing?
Right. It's worthwhile talking about this. These are real miracle medications, and when they came out, it was such a turnaround in the life of men, because prior to the advent of these medications, people would have to give themselves shots in the penis, which still exists and can help in desperate situations where the pills aren't working. But the proper use of the pills is as follows. There are basically two popular generic medicines, Cialis and Viagra. There's some non-generic medicines like Stendra and whatnot, but they're pretty expensive and, to my knowledge, don't really work any better than Cialis or Viagra. The difference between Cialis and Viagra is that Viagra is given usually in a 100 milligram dose an hour or two before sexual activity. And then the medicine will remain in your system for about 6 to 8 hours. And then after that, it dissipates. And if you want to be sexually active the next day, then you need to take another pill. With Cialis, it can also be used in that same fashion. You can take a 20 milligram Cialis pill a couple hours before sexual activity, and the duration effect will last longer. It will last like maybe 36 hours and then wear off. And if you want to be sexually active, say 2 or 3 days later, you need to take another 20 milligram Cialis pill. Where people get confused is that Cialis is often prescribed on a daily basis. So in that scenario, men are given 5 milligrams every day, and it builds up in your system so you get the same level as if you took 20 milligrams after maybe 3 to 5 days of taking the medication. And I see a lot of confusion where men will get a prescription for 5 milligrams and they think, well, I'll just take this on the day that I'm going to be sexually active. And they don't get results because their dosage isn't big enough. The daily dose requires 5 milligrams on an ongoing constant basis, and then it will work as well as the Viagra does or the large dose Cialis does, but it won't work well unless you continue it for 3 to 5 days so that the levels can build up in your bloodstream.
Thank you for clarifying that. When it comes to radiation, how often are you seeing patients, like what percentage of patients would you see immediate erectile dysfunction issues or versus 2 years later?
Well, it's sort of a smooth continuum. So some men, if they go through radiation, they may start having difficulties with erections within a month or two. Others, it may take 12, 15 months. The confusing issue about this whole discussion, of course, is that some men will become impotent after radiation and others won't. You can take two 60-year-old men, perhaps neither is taking Viagra or Cialis at baseline. As men get older, sometimes they're already taking these pills. And one will become seriously impotent, the other won't have any problem at all. So we haven't figured out why the risks of erectile dysfunction or the occurrence of erectile dysfunction is happening in certain individuals and not happening in others. We do know that if people are already taking pills or if they have pre-existing problems with erectile dysfunction, that they're more likely to develop more serious erectile dysfunction than the person who at baseline doesn't have any pre-existing problems.
In the video, when it came to surgery, we were talking about, is there anything you can do before you get the treatment to help, continue to mitigate side effects sexually? Is there anything you can do previous to radiation?
Not that we know of. There's been some talk about administering Cialis on a daily basis. There's apparently some sort of an exercise function that occurs with men's normal sexuality. Men will get erections at night while they're sleeping, and this exercising of the muscles in the penis is probably a critical part of maintaining normal erectile function. Some have suggested that keeping people on Cialis before, during, and after radiation may improve the long-term functionality. That really hasn't been proven. It kind of makes sense, and it's a logical thing to consider. I think it becomes an even more important consideration in the men that are doing hormone therapy, because they routinely do lose the nighttime erections that are part of normal male physiology. With radiation, I'm not certain that taking Cialis when you, quote, don't need it, if men are getting erections, will make a difference in long-term functionality. But I do believe that in men that are undergoing hormone therapy, that they will probably be better off if they're on continuous Cialis, and even make an effort to be sexually active, to try and get erections on a periodic basis, because they're not going to be getting them at nighttime like their normal timing would occur if they weren't on the hormone therapy.
What is the reason the erectile dysfunction and the recovery of it when it comes to surgery versus radiation? Why is it so vastly different?
Well, of course, in some men, when they have an operation, the nerves are cut inadvertently. They try and do nerve sparing, but the nerves are the size of human hairs, and it's easy to inadvertently cut them. So that's one reason that erectile dysfunction can occur immediately. But we do know that depending on the patient's age and the quality of the surgery and other factors, that some men will recover erections over time. The reason that is used to explain that, never proven, is that the nerves are somehow shocked by the surgery, and that they go into a period of shock, and it takes a while for them to recover, and then men can start getting erections again. One thing that has been clearly shown in studies is that the quality of erections after surgery is diminished compared to the quality of erections after radiation. And this has been validated in some very clear studies where couples are asked 2 years after the treatment. So there's enough time to recover from surgery. There's enough time to become impotent after radiation. So they either go through surgery or radiation, and then 2 years later, they ask couples a simple question. Are your erections the same as they are prior to treatment? And unfortunately, only about 5% of couples who've had surgery say that they're the same as prior to surgery, whereas with radiation, about 50% of the couples say that they're the same as they were prior to radiation.
So we have whole gland radiation, and now we're hearing a little more about focal therapy when it comes to prostate cancer. Will that help mitigate sexual side effects? Is there anything that men can do to mitigate it besides focal therapies?
When you undergo experimental focal therapy, where they don't treat the whole prostate, when you have surgery, they remove the whole prostate. With radiation, standard radiation, they radiate the whole prostate. So when you treat a smaller portion of the prostate, that there is going to be a better chance of not becoming impotent. That is quite clear. The whole field is poorly regulated, and there's a lot of startups with laser treatments and high-intensity focused ultrasound and cryotherapy, even focal radiation therapy. There's great difficulty in figuring out who really knows what they're doing in this area. But it's a logical thing to consider if someone has unilateral disease that's easily visualized on an imaging study, to just treat the tumor with a margin around it rather than treating the whole prostate. And this is particularly important in men that are trying to optimize maintain normal erectile function after the treatment.
So in our video in regards to surgery, we talked about injection therapy to achieve erections. Is that something that also needs to happen when it comes to post-radiation care?
If men start to develop erectile dysfunction after radiation, it's it's not the same mentality. After surgery, if they've lost erections, they may recover with time. If men after radiation start to develop erectile dysfunction, we're not expecting them to recover. We're expecting it to be a permanent problem. One role, I think, for injection therapy in people that are having radiation is those that are getting hormone treatment at the same time. And that oftentimes radiation is given with hormones, maybe less so now in this era of PSMA PET scans, but still very popular. And as we said before, men start losing the ability to get erections when they're on hormone therapy, or they're just not interested. I think since men can develop irreversible atrophy during these long down periods without any nocturnal erections, that it's quite prudent to think about doing injection therapy in these men that are undergoing radiation and hormones and who aren't getting any erections, to consider consulting a urologist to learn how to give an injection once a week to keep things functional until their hormone therapy wears off.
So when would you start that? Right away after radiation?
It's more related to the hormone treatment than the radiation treatment. And I think it also would depend on whether these individuals are going to be on short-term or long-term hormone therapy. Some of the new protocols with hormone therapy using Orgovyx, they're only on treatment for 4 months. They can take some Cialis, they'll probably be fine. But some of the hormone therapies that are administered to men that have lymph node involvement, they're going to be on treatment for 18 to 24 months. And if they're holding out hopes of getting back to their normal sex life, they probably should be doing injection therapy during that long down period.
Today we talked about the sexual side effects that can happen with radiation. A couple of things come to mind. First of all, be bold when you're talking to your doctor about these things. Talk to him before you decide upon treatment. What are going to be my sexual side effects, and what's the game plan if those things happen? I think if you've watched our other videos on, sexual side effects of surgery or other types of treatment, you realize that it's different for every treatment, and even the timeline of when it can happen is very different. So I think it's important to weigh your options and know ahead of time of what could happen so you can create that game plan, talk to your partner, and still have intimacy in your relationship. If you need help with your individual case, you can go ahead and contact our helpline at pcri.org/helpline. The link's in the description below. Please like and subscribe to our videos if this content was helpful to you. This helps spread the prostate cancer videos all around the YouTube platform, and it's very helpful to us. Also, we are a 501c3 nonprofit organization, so if you would like to donate and partner with us, the link is also in the description below. But most of all, please remember, above all else, you are not alone. We are here for you. If you need help, hopefully it's in our videos, and if it's not, contact us. Our helpline can help. But the entire prostate cancer community is here with you, and we hope you have a great week.